Now I'll do objective examination of the cardiovascular system. Upon inspection, there is no cardiac humpback, it's absent. Apex beat is visible. Cardiac beat is absent. There are no abnormal positions of the aorta, aortic arch, and pulmonary artery. There is no distension of neck veins. There is no undulation of jugular vein. Flash sign is negative. Can you please show me your fingers? Queenie sign is negative. Worm sign is also negative. Now I'll start palpation. Apex beat is palpable. Cardiac beat is not palpable. There is no abnormal positions of the vascular bundle. Systolic and pre-systolic trills are absent. Now I'll move on to percussion. Upon percussion, the borders of the heart are normal and they are not changed. Now I'll do auscultation. Upon auscultation, there are no murmurs of the heart sounds. Now I'll do the inspection for the peripheral vascular system. Upon inspection, while patient is in standing position, I notice there is varicose vein on the right calf and there is hyperpigmentation as well as swelling in this region. Now patient, can you please lie down? Now I'll do inspection. Now I'll continue the inspection when patient is in a lying position. Upon inspection, there are no bulging of the carotid artery. Abdominal pulsation is absent. And there is no pulsation of the arteries on the ankle and the foot. So now I'll do stretch test. Patient, can you please bend your leg? Can you please bend your other leg? Okay. Now I'll measure the blood pressure. Okay. So after measuring all the ankle breaker index of each arm and foot, the ankle breaker index is 1:1. So there is no abnormal in blood pressure of the ankle breaker index. So now I'll move on to palpation. After palpating the pulse, body pulse is present, cerebral pulse is felt, abdominal pulse is not felt, the dorsal as well as posterior tibial is felt, and then I do not suspect there is any problems with the arterial system. However, I will do auscultation to make sure. So upon auscultation, there are no bruits heard in the carotid, subclavian, abdominal, renal, and iliac arteries. Therefore, I do not suspect any problems with the arterial system. Now I'll move on to the venous system and inspect the varicose veins on the right calf. Now I'll check for the saphenous femoral junction pulse. Okay, the saphenous femoral junction, there is pulse present. Now I'll move on to the legs. Upon inspection, the right calf seems to have hyperpigmentation and is swelling compared to the left leg. Upon palpation, the temperature on the right calf is warmer compared to the left calf. And upon further inspection, there is varicose vein visible on the side of the calf. So I will give a conclusion on the cardiovascular system review. So upon inspection, palpation, percussion, and auscultation, there is no problems with the central cardiovascular system. However, for the peripheral vascular system, it is compromised. And this is varicose veins, and there is hyperpigmentation on the calf, as well as swelling and edema, and it is pain to the touch. So according to the classification, this is stage 2 of varicose veins because of presence of hyperpigmentation of the calf. So based on the symptoms, the diagnosis for this is thrombophlebitis of the saphenous parvus. And according to the CIP classification, which is the clinical, etiological, anatomical, and pathophysiological, according to that, it is C4 due to hyperpigmentation. There's edema and also varicose veins. As for the etiology, it is primary cause and anatomically it is superficial. Last, pathophysiological, it is thrombosis. Why it is thrombosis, we need to see for duplex scanning. So in duplex scanning, we see red and then it turns blue. So this indicates that there is venous incompetence. And this shows that it leads, there is a thrombosis that compresses the veins. So patients should be admitted to the peripheral vascular surgical department. So for the lab tests and instrumental tests that I would order, so firstly, it is the hemostatic test. So this includes APPT, PT, bleeding and clotting time, as well as a very important indicator, which is platelet count. So the next one I would order is a routine of a total blood count, which this is a screening test, and also a urinalysis, which is also a screening test. As for the instrumental test, so firstly is the duplex scanning of the vessels as mentioned. And next is a screening test, which is a plain chest x-ray. And lastly, we could order a plethysmography to monitor the level of edema on the legs. And this is monitored over a few days to detect if there is any changes with the swelling, whether it's decreased or increased. So for the treatment plan, so what I would order for the patient is firstly anticoagulants. So this is to stop the thrombus from growing, and one of it is heparin.
due to the condition of the patient. So heparin is needed to prevent the thrombus from spreading into the central venous system. Next, I would also give the patient non-steroidal anti-inflammatory drugs for pain relief. And lastly, what I would order for the patient, or I would advise the patient to do, is to get elastic stockings, or if it's possible, the patient can elevate their legs. And also, last but not least, it is surgery. So this surgery, it is indicated not because for cosmetic purposes, but rather it is to prevent complications. And this surgery is known as crossectomy. For crossectomy, where we ligate the peripheral vein from the central vein to prevent the thrombus of from the peripheral vascular system to grow into the central venous system. And this will prevent any further complications for thromboembolism.